Welcome. This is an Iowa Online Nurse Residency Program Resident Spotlight with Program Coordinator Jessi Grote. Today's guest is RN Lexus Barnard from Upland Hills Health in Dodgeville, Wisconsin. Lexus completed the IONRP in March 2023.
Hello and welcome. We have with us today Lexus. So Lexus, I'd love to hear from you. Just kind of a brief introduction, your name, how long you've been an RN, and then what type of facility or unit you work on.
My name is Lexus. I, through the residency program, was working on a medical surgical floor at a rural hospital in Dodgeville, Wisconsin. I worked on the floor for a year as a nurse. In February, I did transition to our surgery department. So I've been doing that since February, and I've been loving it.
So my first kind of question, I'm just curious to know, how did you apply the concepts covered in the program to the area you work in? And you can think kind of the med-surg world and then also the surgical world if you want to touch on both a little bit.
So I felt like overall I applied the concepts by peer-to-peer, just learning how to work with my peers, talking with patients, gaining my confidence, definitely learning how to work through conflict with patients, families, doctors, just overall communication skills, as well as just focusing on my mental health. I think, your first year of nursing, nursing school is hard enough, and then you get out into the real world and no one really prepares you for what it's really like. So I felt like the program really prepared me for that.
So would you share with us what your professional experience focus was on?
So my professional experience focus was on bereavement and grievance in our patients. I felt like our facility did not have a way to help our families and patients during that grieving process. So I was able to incorporate a project that positively affected the floor by bringing in gifts for the families and a way to kind of memorialize the patient after their passing.
What did you find to be the most beneficial aspect of the program?
I would definitely say the monthly check-ins. The reason I would say that is because I would have an awful week, and then I would write in my journal about it. And then when we'd meet as a group, I would be able to hear from other peers and be like, I'm not alone. This is exactly how I'm feeling also. And then it was nice to get skills and tools to kind of help us cope with those feelings and realize we're not alone.
That's wonderful. Thank you. Well, anything that you'd like to share with current or future residents?
Again, knowing you're not alone, knowing that there's people, whether it be your site coordinator, your instructor through the program, or just your peers reaching out, just making sure you're talking to people during that year, because, you feel like you're trying to do your best and your best is not working. And in fact, you're doing great. You really are.
I love that. Thank you so much, Lexus. It was great to have you with us today, and we'll chat with you soon.
Yeah, thank you so much.